Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about dental inlays and dental onlays. Dental inlays and onlays are a middle between dental crowns and dental fillings. They are primarily implicated on teeth in the back of the oral cavity who has experienced an average degree of tooth decay. In addition to this, inlays and onlays could additionally be put on teeth which have experienced a little fracturing. A lot more severe fracturing will most likely be solved with a dental crown. A dental inlay is much similar to a dental filling, with the variation in which it is placed within the bumps on the tooth-eating surface area. A dental onlay is able to go over a few cusps or perhaps bumps, because they are bigger than inlays. Inlays or onlays are not as big as crowns, then again much larger compared to fillings. They are composed of composite substance, ceramics or perhaps gold, that could be bonded into location to restore destruction to the tooth's chewing surface area. Instead of choosing a basic dental filling or a dental crown, a dental surgeon tends to make use of an inlay or an onlay. Inlays and onlays could be produced from porcelain, gold or ceramic resin. However, porcelain is currently growing to be the component of preference as a result of its durability and possibility to match up the organic shade of the tooth. An inlay looks a lot like a dental filling and sits inside the cusp points of the tooth. They are customized to fit onto the setup cavity and after that cemented into position. An onlay is usually a more substantial reconstruction that deals with several cusps of a tooth. Onlays are recommended in scenarios in which a considerable reconstruction is necessary. Still, much more of the tooth construction could be preserved unlike the setting of a dental crown. Types of dental inlays and dental onlays. Porcelain inlays are most typically useful for front teeth or perhaps some other tooth enamel that display anytime you smile. Resin inlays are usually designed for individuals who grind their teeth. Gold is generally applied if look is not an essential matter, for example in the back teeth. A few forms of tooth-shaded inlays and onlays are completely designed mainly to be used in large imperfections in back teeth. They are utilized in location of a dental crown or dental filling. These are composed of porcelain, some other ceramics or plastic material. These types of components are created in a laboratory and cemented into position with a liquefied plastic material type of cement. 2 visits are needed for their finish. These are wonderful restorations, similar tooth construction practically the same, however they never have been applied long as much as necessary for best analysis understanding of their long-run qualities. For almost 100 years, solid gold inlays and onlays are usually considered by a lot of dentists like the ideal, long-enduring approach to restore teeth. Inlays match within the chewing surface area of the tooth, where onlays protect the top of the chewing surface area. Most of these restorations function for the majority of a patient's lifetime. But, they may be hard to achieve, pricey and very requesting of the dentist's expertise. For back teeth, metal restorations are the leading options. Silver amalgam or even solid gold restorations are tough, suitable options, however are significantly less satisfying to look at. Dental inlays and dental onlays procedure. Direct inlays and onlays could be set up in just one stop-by, because they are made in the dental medical center. Indirect inlays and onlays require 2 appointments for setting and they are produced in a specialist laboratory. The dental surgeon are going to firstly numb the tooth, along with the surroundings with a local anesthetic. Individuals may additionally get other forms of sedation, such as nitrous oxide. At this point, the tooth decay is eliminated and then tooth is formed. Your dental surgeon from there will position composite resin which is shaped to match the tooth. Dentists are going to after that eliminate the inlay and also make use of a unique cooker to harden it. The solidified inlay is going to be cemented onto the tooth. From that point, the inlay is finished and formed by the dental surgeon. Advanced Solutions permits dentists to create ceramic inlays or onlays right into the dental office, with setting completed in one appointment. After this, the inlay or onlay could be reshaped to adapt to blend the teeth. There are actually a very few problems related to dental inlays and onlays. Generally, the problems tend to be more related to the local anesthetic employed to numb the region for the treatment. The reason being certain individuals are allergic to the anesthetic and response can be extremely severe. On the other hand, the affected person could have an allergic reaction to a component which makes up the inlay or onlay, even though this really is uncommon. After dental inlays and dental onlays, stay away from chewing tough items if you want not to fracture the tooth porcelain. Regular brushing together with flossing. Make use of fluoride mouthwash and also toothpaste like recommended by your dental surgeon. There is certainly a chance that the inlay or onlay could loosen up. That'd be the case once the cement becomes rinsed away or perhaps saliva happens to be combined along with it throughout applying. For inlays or onlays which are composed of porcelain or perhaps composite resin, fractures could establish. Dental inlays and onlays could easily work for many years. On the other hand, this will depend completely on a number of elements. An important effect on the length of time they last is the component that the inlay or onlay consists of. Additionally, the real tooth that the solution is put onto could be a huge deciding element in how much time they endure. Tooth sensitiveness, brief or extended, could be found in some of these restorations. In case tooth sensitiveness continues, tooth root canal treatment could be required, however this is occasional. A few tooth-tinted restorations crack throughout service since they are much less sturdy as those composed of metal. In case breakage happens, the repair could be made again. Since these types of restorations is not being applied as far as metal treatments for back teeth, information about the extended program is not finalized. Go to your dental surgeon in case the inlay or onlay loosens or perhaps comes outside of the tooth. There are plenty of good things which are related to dental inlays and onlays. Mainly they can be very beneficial in the therapy of tooth decay along with eliminating sensitiveness of the teeth and also tooth damage. The capability to choose genuine shaded inlays or onlays to cause them to become hidden, therefore your smile may not be more unpleasant looking. Since the inlays and onlays commonly are not made up of metal, such as traditional fillings, they are going to not modify in form or dimensions in case the teeth are exposed to variations in temperature. Dental inlays and dental onlays cost. Generally, these types of restorations need 2 visits as well as some quite complicated laboratory effort. The required knowledge and work demands a price which is close to or equivalent to that of solid gold restorations or around 6 to 7 times more compared to composite restorations. The cost of a dental inlay or onlay is based mainly on the component applied. In case you're having insurance coverage, the cost additionally relies on when your insurance provider classifies an inlay like simple dental care program or perhaps a serious therapeutic method. Insurance firms categorize dental inlays or onlays like possibly basic or perhaps major treatment and have a pre-established refund level for every form. In case your insurance provider thinks inlays or only fundamental dental care, the identical classification given to fillings, cleanings as well as other easy dental treatments, it is going to probably refund you for about 80% of the treatment. In case the insurance company thinks an inlay a serious treatment, it is going to probably refund you much less of the cost, possibly around 50%. On many occasions, your dental surgeon can supply you an estimation according to the insurance company you have. Tooth-tinted inlays cost more compared to metallic tinted, however vary just in looks, not perform. Like the majority of dental treatments, the cost of a dental inlay or dental onlay will be based upon the particular tooth or perhaps teeth implicated. Back teeth, for instance, tend to be more hard to get to and need additional time and effort. Therefore the price is increased. Treatment on front teeth demands significantly less effort, thereby costs much less. The dimensions of the dental inlay or dental onlay likewise impacts cost. Larger sized teeth need bigger inlays or onlays, which cost more due to the volume of components applied. Porcelain inlays or onlays could effectively produce both equally aesthetic and also practical results in repairing tainted or metallic teeth. At last, the key benefit to onlays and inlays is the fact that they permit your dental surgeon to salvage the most of your genuine tooth as they are able to. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.